Hi,
Hi, how are you?
I'm good. I'm just getting everything set up. Uh, right before this, I had a delivery and he couldn't make it up my driveway. And we have some crazy weather going on. It's like nice and beautiful a minute, and then they're having whipping rain. So I had to meet him at the end of it's anyway. So I made it
Very
at
good.
4 o'clock.
Yeah.
Woo! I just simple victories, little simple victories is all I can think about right now.
Yeah,
Give me
you know
one
what? I
second.
hear you. Did your
Mhm.
hurricane come past? I was concerned about that last night.
Could you say that again? I gotta have my headphones on. What now?
Did your hurricane come to pass? You were concerned
Oh,
about that last night.
tornadoes. Um,
Tornado, right?
yeah. They pass through. We had 40, 50-mile-an-hour winds, but if it gets to 60 is when they turn it from a watch to a warning in
Mm.
our areas, and they give us good amount of time, you know, and they track it for each neighborhood. That's great. But at night, I don't know what to do. I don't want to
Mm.
sleep in my pantry,
Yeah. Oh my
but I
gosh.
might. Yeah, I might do that if I have a warning. Me and my dog.
Right. It's the safest
We'll
place
have
in
all
your
the
house,
food.
I guess.
Yeah.
Yeah, you'll have all the food. Yeah, that's good.
Last night I
So
thought,
how
should I
did
brew you
you
some waters?
yeah, how did you enjoy the call last night?
Very much so. And I'm telling you, you reached me through LinkedIn. And I've been looking, searching, hoping for something like this. I wanted, I really want to do something with women's health. And because I'm struggling with mine right now, I'm 50 years old and I had, the surgical menopause and it's very bad. It's really rough, but also for the genetic testing, it's really important to me for people my age who don't think about it and they just go get on hormone drugs, and because they're feeling a certain way, you can get put on hormone replacements. And the reason why I even knew that I had it in my body is one of my cousins. I have several. I have like 30 first cousins. half of them,
Wow.
half of them are BRCA2 positive now. That tested.
Oh,
So the first two are in their 50s when the time where you start doing your hormone replacements, and they're the cancer that was in them, they both get mammograms, they both, but the cancer that was in them exploded. It made the cancer explode like poof,
oh,
and within months of taking that HSR, hormone replacement therapy. I don't know what you call it there. Um, so, I would have been about the time where I would, in my 50s, I would be about the time looking for that. And now that I did the genetic testing, um, I did with a genetic counselor from Vanderbilt. That's where I go for my health care is Vanderbilt. They they do genetic counseling. And so I wanted to do, I did all of that and they came up with a number for me that it was 87% likely that I would have breast cancer, and especially if I decided to do hormone replacement, it would be definitely. So I have other issues. I have other issues, and my breast and my ovaries and my tubes aren't really my issues right now. I'm 50 years old. I don't have kids. I never had kids. I never needed my breast. I never needed the tubes and everything else. So I just decided to get rid of them. And for my chest being flat, What I had been doing, most of my friends have implants. It's like I live in Nashville. Um, Everybody has implants here. You know, it seems like all of my friends do, and some of them were having some issues. And 2 years ago, when I decided to do the flat, they, said I need to have counseling because I didn't want to replace my breast. So I'm like, huh, that's a good idea. That's good. That's a good one. I was like, sure, send me to behavioral health. Let me make sure I am understanding that these breasts will be gone, and they'll be flat, and make sure I'm understanding what I'm getting into. But the opposite isn't true. Like I didn't even know that aesthetic flat closure was an option. I had to research it.
Right.
And I found out that it is an option. I don't have to get implants. So one of my best friends has had medicine. Well, she had breast cancer about 12 years ago, and she had them removed and replaced. And she said she didn't remember that being an option for her. So she went, and she's like a natural holistic woman, who doesn't really want these big jugs like sticking out on her chest, uh, the um, the prosthetic breast or whatever. So
Yeah.
just about 2 years ago, she got she had metastatic cancer in her chest wall, and now she still has these boobs these fake boobs and all. It's a lot. It's a lot to deal with. It's a lot to deal with. And now you're just like, what to do? But what I would like to do, and I don't know how to do it, is to make flat normal. It's a normal decision. You don't have to, even if you are flat on one. I mean, I had one friend that had her breast, one of them got infected during 2020, and they just popped it and left her other boob. So she had one gigantic boob and nothing for a year.
Right.
And
Wow.
so I'm like, just have them go in and pop the other one. But
Oh gosh.
so she would be normal. But I mean, she had had infections, and um, another coworker had infections. Anyway, I'm wanting it to be normal, not to even wear boobs, fake boobs.
Yeah. Yeah.
I'm just wanting people to express, like shoulders back, down, and this is my shape now. This, I don't need this anymore. Whatever. I mean, I've done some therapy on this. I've been in therapy for about 2 years over this. Um, and it's brought me through a lot of pain and tragedy. Just 6 months ago, my partner told me that told me he's going to be okay with it. About 6 months ago, he told me that because of my surgeries, he is now addicted to porn.
Oh
Yeah,
gosh.
yeah,
Oh
it made me really upset.
yeah.
And I don't need that. And I'm glad it took 6 months. We had a very terrible 6-month breakup. And he's gone now. And I own that house again. And and he's in Washington. But that's just so bad to me, so sad, and I don't want women to experience what I've experienced with
Yeah.
some guy needing to have breasts, fake or not, to get him turned on. I
Yeah.
always thought I would never date a man who that was the most important thing, you know, and I thought I was just felt betrayed. But I'm working on it and I'm going forward. But I think there are women out there who experience the same things. They don't want to keep getting the replacement, like it only lasts 10 years and they keep replacing their breast. And I know this is probably, well, I don't know. I really want to take your scar science. I want to talk to you about all your classes because I'm on board. I just need to know how, like, um, I just want you to know that I want to take all of your classes, and I need a breakdown of the financial cost, because that would be the deciding thing for me, is how am I going to afford it? How am I going to afford this? But I do want to learn the scar science. I want to learn that so bad. I've got scars. I mean, I've got all sorts of scars, and I find scar tissue on people and they have no idea about it. I want to learn, well, when I had the BSO surgery, do you know what I'm talking about? The bilateral, um, anyway, it's my ovaries and tuberies, my
Like a
tubes and
tubal
ovaries.
ligation? Right.
Yeah, and ovaries.
Right.
Um,
Okay.
okay. So I had that, and the doctor who did it laparoscopically, and she said, just on a incidental finding or whatever, that she saw scar tissue, scar tissue on my appendix and my cecum. And I just wonder, well, how'd that get there? That could be a problem with my digestion, because now I did find out recently I have a tortuous colon. So the one that turns and twists, that's
Yeah.
been my problem. That's the reason why I've decided to get rid of what's not serving me and really kind of focus on the thing that's really bothering me, which is my gut and
Mm.
issues. So what would you like to talk about?
I want to talk about you mostly.
Okay.
Yeah. Yeah, because I mean, you got to hear about me last night and where I'm coming from and why I'm doing this work, and I'm happy to answer any questions that you have, of course, and we'll definitely go into the courses. But for me, it's really important to know you and where you're coming from and what you're looking to get out of this, and what gaps you have between where you are now and where you want to be in your future, and then we can see how we can line up what I have to offer with what you're looking for so that you're getting what you need out of it. That's the most important thing for me. Yeah.
Well, it feels like I was searching, I've been searching, and then one day you are in front of me. You know what I mean? Just looking, I
Yes.
mean, on LinkedIn, I'm like looking, and it wasn't you, but it was that National Certification Board. Did you advertise or something through that? I don't know how it works, but
I
I
did
saw your
a
information through them.
Okay, great. Yeah, through the national. So that's the American one. There's a Canadian version and an American version. So you saw the
I don't know
American.
then. I thought I did. I thought it was the National Certification Board,
Yeah.
but they
Yeah,
changed the
because
name of that, so I don't know.
yeah. Yeah, we've been reaching out to the different national organizations so that people can find us and feel like, okay, this is something legit. There's some people with some know-how behind us, and you can feel confident that what you're coming across is something that's trustworthy information. It's not just, some pie in the sky stuff that's been put together and sounds great, but it's not really backed in anything. So when we're um, getting the approval of these national organizations, then we have to jump through all the hoops in order to get the
Mhm.
approval. And then when it comes to you, it's like, okay, this is legit. This is good. Yeah. So that's good to
Do
know that
you
that's where you found us.
also, I was just wondering if you have contacted ABMP. Let's
I think
see.
so.
Let's
Yeah, ABMP.
see.
Yeah, I think we're in process with them.
Because they offer free courses, like an hour, a free hour course. And so you can, the online ones. And so if you can rack up your free ones, take the test at the end, you get that 1 hour of credit, which is, some people just need one more credit.
Right. Yeah. Yeah. Yeah, that's a great suggestion. I think we're in process with them. Yeah. Yeah, I've been a primarily Canadian focused company, but I want to expand past just Canada. Like we've trained people in the States. We've had some people from Texas, from New York, from Seattle, from Michigan, Montana. Like we've had quite a few states, but more people from Canada. And so, and I thought I was 375 people that I've trained, but I actually looked it up last night and I think it's actually more like 475. So there's an extra
Oh,
100 in
wow.
there. Yeah,
Let's
which is
throw an
really
extra
cool.
100.
Yeah, throw them in there. But there's so many massage therapists in the state, and
Hmm.
the I think the culture around massage therapy, it's a little bit more challenging in the States because you often work, this is my understanding, you can correct me if I'm wrong, but it's often back-to-back appointments, a lot of appointments in a day, and you kind of have to like get them in, get them out, and move along to the next person, and it's pretty vigorous. Is that your experience?
That's that's my experience working in the hotel industry.
Right, right.
I've worked with chiropractors. I don't like to do that. I have worked on my own. I had my own office space downtown, and just rent your own room downtown. And I was there for a long time. I've only been at the Omni for 10 years. I'm so tired of it. I'm so tired. I mean, I think I told you the lady told me I was masterful. This one's saying amazing, and told the guy in the bathroom. The guy in the bathroom came out and said he needed to get a massage from me. And I'm like, I don't know where in the space I was, but I was really touching. I mean, I was really paying attention and really putting my energy, to them. Sometimes I could fall asleep doing the same thing over and over. It's like, when you're driving the car and it's like it's too warm,
Mm,
but it's early in the morning, you kind of close your eyes and you're back up again. That's the way it
yeah,
felt, that's the way it feels sometimes. It's
yeah.
just so boring. And
Hmm.
but with Tennessee, I want you to I'll send you our rules or whatever and statutes. They have the rule or statute. I'm gonna load it into AI and ask it to tell me what the rule is, what the real thing is, and like, can you tell me what this means? But basically, they don't. Um, you can only do breast massage with same gender, no cross gendering, and that's why I was wondering. It's like, would the person who is gender affirming, would that be a cross gender approach? Because just remember, Tennessee is very conservative. I'm not conservative, but most of the state is, like, on
Right.
draping, everything. It's hard.
Yeah. Yeah, I can appreciate that. And I'm not totally sure how it would work with the trans and non-binary population with that. Most of the people that you would see would be female, identifying as female, either going through elective breast surgeries like your friends. Lots of them have augmentations. So, those types of breast surgeries, elective breast surgeries, and sometimes people end up getting explants because they no longer want the implants in there. And so then they
Hmm.
get explants, or they're going through breast cancer, they're getting breast cancer surgery. That's all very female centric.
Hmm.
Um, it sounds like doing chest massage on a man, like identifies as man, born male, man in all sense of the word, is would be okay or would not be okay because it's not breast massage. If you were working with a trans woman who was assigned male at birth, but then didn't feel male and so transitioned to being female, and you're helping her as a part of her gender transition, that I don't know whether that would be allowed because I don't know how they stand on the trans community. But honestly, they don't come in for treatment that much. Mostly the people who come in have had their breasts removed because they're either a trans male and feeling like I shouldn't have breast tissue. They were growing breast tissue because that's the hormones that nature gave them, but they don't identify female and they're like, it's not right for me to have these. What did you call them last night? Fat bag?
Fat
That was
bag.
you, right? Yeah. That's probably how they feel about them. And yeah, and then same with the non-binary population where they're like, I don't identify as male or female. I just, am
I just am. And
somewhere.
so,
Yeah, I just am. Exactly. And so I don't know how, but those are mostly breast, off, in which case you're just dealing with the scars on the chest. Like for you, you've now got your scars on your chest, right?
Hmm.
And it's not breast tissue anymore because it's a different shape.
They took
It's got a
all my
different,
breast tissue away.
right. Yeah, which is quite common with the breast cancer, anything breast cancer related. They're like, we can't have any breast tissue. When you're working with the gender affirming surgeries, sometimes they will leave a little bit of breast tissue in because they want some contouring. You can't tell with the naked eye that there's any breast tissue in there, but they do leave a little because they want to try and create, you know, just a bit of a different shape that could be identified more either as male or just a little bit of a fuller chest than what some of the breast cancer ladies have. So I don't know if that would apply. I doubt it. It's probably more of a nuance
I
that
want to
the
I want to
state
advertise
wouldn't.
it anyway because
Yeah, yeah,
I am so I'm very extremely gay friendly, and I
right.
want people to be who they want to be as you
Hmm.
are, be your best self, and you know, I encourage you to do that, and I would like to be, even though I may not get any, I would like to add that, you know, add it to my list that this is what, you know, this is someone who is welcome here. And
Yeah.
even that, like I said, even if I don't get anybody, I just want it to be, you know, noticed that they are welcome.
Yeah,
And
and
I
I
know
think
what to
that's
do
really
with it.
important. Yeah, yeah, I think it's really important because they need to know there's somewhere safe that they can go and there's someone who can receive them and who can, you know, be a part of their medical transition, and especially in a conservative environment
Hmm.
where they may not feel like there's very many safe places to go. Then if there is a place they come across, they're like, oh, thank heavens, you know, there's this is a safe island. I can get what I need done and um,
If
you
I
know,
can get
not
this
feel like
going,
there's any danger.
if I can get a business going, I would have people from several states because there's nothing. I mean, I am not a conservative person, but I live in a conservative state.
Yeah,
And
understand that.
that's Kentucky. I mean, I can, all of these areas, even Indiana, anything that's like 2 or 3 hours drive from Nashville, you know, Georgia. I mean, Georgia's 4 hours, but I mean, there's so many places. I mean, there's just not anyone advertising for that, or I haven't, that I've seen.
Yeah. Yeah, and that's exactly why we're trying to do these courses so that there are people who are out there so that we can normalize this care. That's what you were saying at the start of the
Yeah.
call. You want to normalize having a flat chest, having scar tissue there, having a new shape, having a new form. And that's exactly what our goals are. That's why this work I think is so important. So people don't have to feel like I'm the only one who thinks this way. I'm having this very, you know, isolated experience and I'm feeling odd. You know, we don't want that. We
Hmm.
want it to be like, okay, this is all right. This is legit. There's other people who are recognizing what I'm going through and I can access the care that I need. And the whole thing is just normalized. It's not so scary. It's not so awkward. It's, you know, people have a greater level of education and understanding. And it sounds like for you, you'd be a forerunner in your area, right? In
Yeah,
your local region.
absolutely.
Yeah.
I
Yeah,
had
which is very exciting.
one of my exes asked me, his question was, well, what are you now? You
That's
know,
quite the question. Oh my
what
gosh.
are you now? What are you now? You know,
Wow.
I know
How
it's,
did you
I live in
respond to
a,
that?
I laughed and I'm like, I'm still, you know, a woman, you know, I'm still the person, you know, I still have the feist and, you know, I still have my own personality, which is kind of, it's hard for some people to take me, but pretty honest and country sounding, you know, it may sound stupid or whatever, but I mean it, what I say, and I don't like to lie. And I do want people to know the facts, you know, like how bad this hurts, what all is going to happen. That I don't know if I told you this last night, but I had a hematoma that night. And then
Oh,
they had to do emergency surgery and had to open it back up. And I had to have 3 blood transfusions in the middle of the night, and they couldn't find
Oh,
any blood. And I'm like, I am like, oh, neg, they should be able to find some of my blood type. But it took 45 minutes to find blood for me, and it was really hard. But I got it, and I've got my levels back up, my blood pressure and all of it. It's just you don't realize that how closely you are to death. If I hadn't known what the numbers were on the beeping, next to me,
yeah.
I looked at it, and I had to have them say, "That's like, this doesn't look good to me," And she's like, "It's not really good. We cannot let you leave here until your numbers are this, you know."
Yeah.
And
Yeah.
that's all I paid attention to, is getting myself to that lower number, to at least get me out of the ICU. And this is the ICU that 2 years before, all the COVID patients were in there, packed in, dying, into the same room. I'm like, I just need to get out of here. Tell me what to do. Tell me what to do. I've got more things to do in my life, I've got more people to
Yes.
love. I got more loving to do.
Yeah, absolutely. Yeah, and there's nothing like these very intense real life experiences to make you realize what's really important to you and what you still feel like I'm here to do. I'm not finished yet. I still have so much more, and it makes it
Hmm.
become more clear, and then often it can light a fire underneath you where it's like, okay, well, now I really want to go forward and I really want to take action on these things because I've come up against my mortality and I realize there could be an endpoint, and at some point there will be an endpoint, but it's not
Hmm.
now. And so I'm gonna make sure that I'm doing what I need to do in order to feel fulfilled. And sometimes people don't get those uh, prompts unless they come up against something really serious. Like I've known people where they just kept deferring their dreams, deferring, because they always thought, oh, later, later, later. And then they got diagnosed with breast cancer, and they were like, now I'm not deferring anything anymore. Like,
Hmm.
I'm not done. I have more to do. And now I'm going to start doing them. I'm not going to keep delaying them anymore. So it sounds like you kind of had a bit of an experience like that as well.
Especially with my friend's cancer coming back in her, the metastatic breast cancer. You know,
Right.
um, it's
Yeah.
no matter what you do, no matter what, boobs on or off, you still could get another round of cancer. You know that
Mm,
that is that just it doesn't even matter.
mm, mm,
No matter how healthy you are, if it's for me, it's in my genes. I know I can be healthy and I can do these things, but I know now that I have extremely high cholesterol. My mother does,
mm.
and my mother's a vegetarian. And,
Oh.
so we are the highest cholesterol people you can, and I have to take a statin, which I don't want to, but I can't just have 300 number, when 59 or whatever is the normal number. I can't be in the 300s. I
Yeah.
mean,
Yeah.
I know the genetics of my things are really complicated, but so are everyone else's.
Yeah. Yeah, for sure. So let's talk a little bit then about, so I know where you are now. You are kind of in the state of I'm working really hard. I'm tired. I've got my own personal experience with breast cancer. I want to normalize things. I want a business that helps me feel like I'm actually making a difference in, people who are going through experiences like this. I want to provide a safe place. So if you were to kind of sum up where you would like to be a year from now, how would you describe that?
Well, I kind of did this two ways in my mind. If I got into like a medical type office space and rented a room, I could do that. But I want to be more closer to where I don't know, like what is it? Just gay people, that they have groups, in places where we live in town.
Yeah,
I
yeah,
figure, why can't I just put up a business in one of their communities, you know, and I could put a business in a community like that, or I could do it in an office setting. Although I don't particularly like an office setting. I like it to be massage session,
Mm-hmm.
lights and dim, and we're
Mm-hmm.
all gonna,
Yeah.
we're gonna get rid of that negative energy, and we're gonna, just breathe and um, I don't know. But I can see it going two different ways. My favorite would be to be in a community that has more people. Like here in East Nashville, it's our youngest. They're called our group. They age millennials. We call them hipsters. But they are in one group of places. And then I live in like the poor side of town, but but I have worked with people, and I know so many people who are in when I did massage traveling in my bag. I know a lot of people that are musicians that are famous. I know a lot of famous people, but I don't know any of them that's had the breast surgeries. It doesn't. I'm thinking if I can find a suite, like a salon suite or something like that, in um, East Nashville, where there's more, I don't know, earthy people.
Yeah. Yeah.
They go to their farmers market. They don't bring in plastic bags. They're conscious. So um, I think building in a place like that. But when I first became a massage therapist, they asked me, where do you see your business? And I did a business plan. And I did a business plan for an area that's called the Gulch here in Nashville. And if I were able to have held on to that, that's $1 million place now. They've got they have taken it from 20 years. It is outrageous. Um, they built hotels and apartments and nice places to eat. There's a turnip truck, like a
Mm,
holistic place to eat. But
mm.
what do you see for me? It's just your feelings.
Well, it sounds to me like what would be most beneficial for you is the Mentorship Academy because it's got business training as a part of it. It's not just the technical training. And it sounds like you want to make some changes in how you're working, where you're working, who you're working with, and you get supported through that whole thing with the Mentorship Academy. So the comprehensive training, it's the technical training. You get all the ins and outs of what you need to know on a technical level, how to work with this population. So you'll learn all about the therapeutic breast massage, chest massage, the surgeries, the complications. That's all the same information. But what you don't get in the comprehensive that you do get in the mentorship is business training, marketing training, the support to make those changes in your practice, to work in a new place, to put yourself out there, to connect with the communities. You were talking like you want to connect with the pride societies and the communities where the trans and non-binary people might be hanging out, and you want to create those relationships with people. That's what we help you do in the Mentorship Academy. So the comprehensive training is excellent. I'm a person of high standards, and I'll tell you, it's excellent. But the Mentorship Academy is, I think, for you, where you would actually find everything that you're looking for. And the whole purpose of it is so that you actually get traction on the changes that you're looking to make. So, when you're doing things on your own, you can have a lot of good ideas, but when you're just going it alone, it's a lot harder. But when you're with a group of people and everybody's focused on that, so they like one of the months it's working with your clinic space or your treatment space, whichever your treatment space is, so that you can be in the area that you want. We've had people who have changed like they were working in a spa and then they went to go work in a chiropractor's clinic and now they're setting themselves up there and all the marketing that goes along with that. So you're supported and, what changes can you make to the environment that you're in that will support this population? How do you put yourself out there on social media? How do you reach the people that you need to reach? All that is supported in the Mentorship Academy. So I think for you, because you're interested in making real change, and that you want the business side of it to thrive, right? It's not just,
Mhm.
you want more than just a few tools in your toolbox, right? Am I correct in that?
Absolutely.
Yeah.
Mhm.
Yeah, and you get guided with the hands-on practice. So you bring in practice people who have actually been through the surgeries, and then you're guided through practicing them. So you do treatment videos, and then you send in your treatment videos, and I review them, and I give you feedback like this draping was really good, this communication was good, this pressure was too much, working with the scar tissue, you would be better doing it with this type of technique, whatever the feedback is that you
Mhm.
need. And then we've got marketing workshops, and it's a one-stop shop. That's what it is. It's a one-stop shop. It is the
I
biggest
have
ticket
a,
item, but that's not the reason that I'm recommending it. I really think it
it's the
fits
biggest
you.
ticket I've but I do have a volunteer for right now. That's they got a lot of ladies are getting rid of their implants and doing the deep flap surgeries, and that's ugly. God, just why are you doing that? But I get why they're doing it. It's mangled, and how long do you think this is gonna last? I'm like, I have no idea, but I will try, so I have one lady that's constant at work, a therapist at work who's constantly complaining, like asking me about my scars, like how long did it take to go clear? I'm like, it's not. But I had revision surgery because I had developed the seroma after the hematoma, and they had to do revision surgery. So I'm still really
Right,
purple.
right. So that
Um,
wasn't very
so
long ago.
the revision surgery was last year. The actual surgery was 22, year
Right. Yeah.
22.
Yeah. So then let me ask you, between where you're at right now and where you'd like to be a year from now, what do you think your gaps are? What's in between where you are now and where you want to be?
I believe the learning, the knowledge. Um, that's that's the only thing that's stopping me. I don't know what to do. I don't know how to
Hmm.
make it better. I don't know how to
Hmm.
make this feel better. I don't know how to make this scar go away.
Hmm.
My
Hmm.
own personal thing. I just use I buy a bunch of the glove mitts for my shower, and I scrub my body, but I scrub my chest. I'm just hoping that I get the blood moving, and that it will kind of heal on its own, but I'm not putting any bandage. I'm not putting any of those strips. I'm not using any of those scar reducers. I should, but I just haven't. I mean, I hope I'm wrong, but I honestly don't see anyone looking at my chest for any other reason than um like teaching. I don't know. I was like, I don't ever see myself dating anyone, now.
Mm. Yeah.
But
After that.
hopefully it will change. I will hope for I will always hope for the person someone to notice me this way, and like it.
Yeah. Yeah. And there are definitely people who are out there, and whether you have breast tissue or not, it's not the prime thing for them. They're more interested in you as a person. Maybe they have a different part of the body that, lights their fire. Breasts are like, take it or leave it. Maybe they're more of a leg man, or, whatever it is, an eye person. Like, there's different things that people like out of a body. And I've met people who have met other partners after having the surgeries, and they were not certain that they would meet another person because they were feeling, vulnerable. They had a negative past experience, and they were like, I don't know, someone's going to like me this way. And then they did end up meeting somebody. So you never know. But if you end up on your own for a few years for whatever your personal reasons are, really good to have other things that light your fire and make you feel like, you're jazzed about life. So that's where I think fields of higher study come in, because then you're learning about something that makes you feel excited. You get up in the morning and you're like, oh, I get to do this today. And
Mm-hmm.
whether you have a partner or not, it's not such a big influence, yeah, on you.
All right, let's break down this mentorship, 200 hours.
Yeah.
Let's
So
break it
let me
down.
show
It ends
you.
in October, right? Or no, March.
Ends in March, yeah. So I've got some slides here. Let me show you these slides because they're useful. So this is our program overview. So first of all, just thinking about the purpose, we want to get you on the ground results, because, we want you to go from feeling like a beginner to feeling like you're proficient at the end of it, and you've made the changes that you're looking to make. And you can do that when you're in a supportive community. So we're here to support your professional development. We're creating avenues for real change, and you do get hands-on experience with live breast and chest surgery patients. And I think of it as you're getting traction on your action, because
Mm-hmm.
you're actually doing the things. And the people who are in the academy right now, a bunch of people said the same phrase, which is, this is the kick in the pants that I needed in order to make the change that I was looking for. So that's its overall purpose. There's three key areas that we focus on. There's the technical training, which is the comprehensive breast and chest surgery training. Everything is evidence informed. You're getting the knowledge, you're getting the clinical skills. It's really high level, and it covers all the surgeries. We'll go into a little bit more of what it covers in a moment. But we also go into the marketing and communication. So this is your business skills. This is helping you present yourself to the world. This is what I'm doing. I'm trying to normalize breast and chest care. I'm trying to connect in with the pride societies. I'm trying to be the person in my go-to area. So you can come and visit me if you're in Georgia, you're in a surrounding state, wherever you are, you can come and see me. And this is what you're going to be able to accomplish with the marketing and communication. And the community relations, like you were talking about with the pride societies, then we give you those strategies for reaching out and for creating those community connections. And of
I,
course,
they,
go
we're
ahead.
so backwards here in Tennessee. We used to have, um, a gay pride in Nashville,
Yeah.
but they've banned it. They've banned
Oh,
it just this year, or
right.
last year. They banned it because this all started because they don't like people being drag queens, and this all started because the city library, which is beautiful downtown library in this amazing place, they had drag queens reading stories to children. And that's what's
Mm.
got them booted from Nashville. So now they've got to go to another town down the road who
Oh,
is willing to accept them. This is the area I'm in, and I hate that about Tennessee. I grew up here, but I don't want to live here. I don't want to live in this conservative crazy,
yeah.
I don't,
Yeah.
but
I understand.
hey,
Yeah, I
I do
do. I
have
understand.
I do have my massage license in Washington State. And I was wondering that scar therapy, scar science one that was in Victoria, and isn't that really
Mhm.
close to Washington State? Is it close?
Yeah, not Washington D.C. Yeah, Washington State. Yeah,
Uh-huh.
it's just across the border. Yeah.
That'd be great.
Yeah, convenient for sure. Yeah, and a lot of what you get in the science of scar tissue course, you get inside the training, but not all of it, because that's a course that I do with another instructor, and so she brings her information and I bring my information, and it's a collaboration between the two of us. So it's really worthwhile for sure.
Okay.
Yeah. So the supportive community, that's another thing that's really important, because when you are making change, you're learning new things, you're stretching yourself, you're growing yourself, you need people around you who are cheering you on, who are on the same kind of journey that you're on, and you're able to ask questions and feel like, okay, there's people who've got my back, I've got their back, we're doing this together. And learning under a mentor, I mean, it absolutely fast tracks your progress. like trying to learn on your own is the slow way
Mm-hmm.
to go. Doing it under the guidance of a mentor, and then you can ask like, hey, I've got this patient in, she's 2 months post-op, she had a lumpectomy plus radiation, she had a seroma, or
Yeah.
you have another patient, they're 2 years post-op, they've got this really stubborn scar tissue, they can't lift their arm up past their shoulder, what should I be doing with them? And then you've got someone to talk it through and, get understanding, because everybody presents a different way. It's one of the reasons why this work is so fascinating, because nobody's presentation is the same, which is kind of incredible. Those are our main areas of focus. Now, in terms of levels of support, we've got really 4 levels. So there's the mentorship, which is me at this stage. So, I'm leading the organization, I'm directing, giving feedback. You've got your peer group, which is educated, like-minded professionals. That's so invaluable. We also give you accountability buddies, because that's somebody that you can, there's 3 of them throughout the program, 6-month program. So every 2 months you change. But the accountability buddies, it gives you that sense of like, this person I can call on whenever I need to, and they're helping me execute the tasks and stay on top of things. You form good friendships and bonds. And then in the private community, you can message anytime. It's only for people who are in the Mentorship Academy. There's challenges like updating your clinic room or reaching out to your practice bodies, whatever things that happen throughout the program. And you can message each other back and forth. So you really feel supported. And this is one thing that the feedback is that we're getting is people are amazed at the level of support that they have. And I think it's really important, because learning in isolation, making change in isolation is really hard.
Mm-hmm.
In terms of community impact, this is something that you talked about a lot, making a difference in your local community, forming alliances and networks. We do get you out to give presentations, to participate in events, to reach out to the doctors, surgeons, and other healthcare professionals in your area. So you are kind of pollinating the garden of your local area with
Okay.
this skill set, and we support you to do that. In terms of the kind of how it's all laid out, the broad stroke schedule, the technical training happens every month. That's the comprehensive breast and chest surgery training. That goes on every single month. And the focus for the mentorship is a little bit different. So the first half, roughly speaking, you're really focusing on practice bodies, getting your marketing basics down pat, getting your marketing assets. So you get like a welcome package, you get brochures, you get social media, templates, business cards, like all those things all laid out. And then in the second half, that's when you really start reaching out to the community, and you're creating your connections, you're doing your presentations, you're actually starting to charge for treatments at that point. So you can still be under the guidance of a mentorship as you make that transition from practice sessions to paid sessions, because the expectation changes when you are doing paid sessions as opposed to practice sessions. And it's nice to have that feedback and support as you are making that change. So in terms of the technical training, this is the comprehensive breast and chest surgery training. So the foundations is where we start, all the most important foundational material so that you're able to do ethical and professional breast and chest massage. Most of it's related to surgery as opposed to pregnancy, but it's still applicable to pregnancy and healthy breast massage if you want to do that. But here we're going into, your proper draping protocols, your entering and exit protocols, language for treating sensitive areas, and working with gender diverse populations, trauma informed care, knowing how to assess and how to do your charting and how to do your intake forms, and your hand skills, so your basic hand skills, all that you get in the foundations, contraindications, precautions, like all those things that you're super well versed, you know exactly how to operate with this population in a very safe and ethical way. Level 1 is where we do the deep dive into the surgery, because as you were saying with the DIEP flap, like they're rearranging a lot of different parts of the body.
Mm-hmm.
There's a lot of changes that happen. And even if it's not a surgery, which is so vigorous as a DIEP flap, then there's still a lot of rearranging that goes on. And you need to know what's going on underneath the skin because there's a lot of changes that is just not apparent on the outside. The scar is compared to what they do on the inside, it's very discreet, like very small. Compared to what happens on the inside of the body, it's like, whoa, there's a lot going on in there. So level 1 is where you do the deep dive. Level 2 is where we get into the complications. So for you, you had a hematoma and a seroma. You would learn about that. Cording, necrosis, breast implant illness, capsular contracture. There's lots of different complications that we go into.
Mm-hmm.
And this way you feel confident with the more complex presentations that people bring you. And some of them you're like, this is actually medical. This belongs to the medical domain. And some of them you're like, I can totally work with that. Some of them you know how to do preventative care so they don't even happen in the first place. That's really important. And then of course the integrative cancer care. This is where you learn about the different types of breast cancer, stages of breast cancer, how to know if you're feeling a metastasis, what chemo and radiation actually are, how they're operating in the body, how do you actually work with somebody who is going through chemo and radiation. And like all my courses, everything is light touch. So you have a variety of different techniques. All of them are very effective and none of them are hard on your hands. There's one exception, which is breast capsular contracture, where you have to do some spot pressures of deep, but
Mm-hmm.
it's not too hard on your hands and it's very effective. But really everything is gentle hands, light hands, very integrative. So you learn techniques to work with these all the way through.
Okay.
So whether you did the academy or whether you did the comprehensive training, this information is the same. The comprehensive training doesn't have the integrative cancer care. It just does the 3 surgical levels, foundations level 1, level 2, and integrative cancer care is separate, but we put it all together for the Mentorship Academy. These are the marketing workshops that we do. So we help you get yourself all set up so that you can put yourself out there into the world. So this first one is called Nurture. And we're teaching about feminine marketing. So it's not so much about pushy sales or coercion or manipulation, nothing like that. It's more about building relationships and being able to talk to your people and creating this relationship with sharing about yourself so other people know, this is the woman that I need to go and see. And because I'm a very practical person as well as a dreamer, I like to have hard and fast things that you can walk away with. So in this workshop, you create your welcome package, which basically means you're personalizing it with your information, but we have the package already done for you. And if you want to change the colors to suit your brand, you can update your phone number, your contact info, your image, then you can personalize it that way. But otherwise, all the information that you need is in there. The second workshop, this is where you are getting introduced to the digital platforms, like how to use Facebook and Instagram well, how to use Meta well, how to use MailChimp so that you can create your message out there. And then same story in terms of done for you. We give you the templates for the brochures and the business cards that we created. And you can change the colors. You can update your contact info, but otherwise everything's all organized for you. So you've got those marketing assets. And then the third one is how you're doing your posting. If you want to do social media, if you want to do newsletters, however you want to be reaching out into the world. So you're creating a schedule for yourself and making it easy and time sensitive. And then we help you create a social media calendar, or if you're more interested in newsletters, creating a newsletter calendar. So you're actually walking away with hard and fast things.
Okay.
And then we go into the digital technology training, because if you're wanting to run a business, you need to be able to use, in the modern world, digital skills, digital platforms. And I didn't realize this was such a thing until I actually started doing this cohort, but there's about 10 different digital platforms that we train you how to use. So there's tracking forms, there's
Yeah.
booking platforms, marketing
I
platforms.
I do all of the marketing platforms, you know,
Okay.
Canva, MailChimp, Meta, and ChatGPT. I
Okay.
do
Good.
Google Sheets and Google Drive. I'm really wanting to retire as a massage therapist, but I'm like, maybe I don't have to retire if I can do something else. And this is the only thing that's caught my attention that's like, oh, I think I need to do this. So
Yeah.
I do travel advising as well, and I've been able to use a lot of these apps.
Yeah. Awesome. So then you're going to be able to integrate what we're teaching you really well and then take it to the next level for yourself. So
Mhm.
that's all extremely useful skill sets. So that's the sort of overview of the program. So you're getting all the technical training, business and marketing skills, and multiple levels of support so you can actually make the changes that you're looking to make. Yeah.
You haven't said
You
how
look
much.
thoughtful. Oh, Christ. That's a small detail, but that's an important detail. I mean small as in tongue in cheek. So there's two different options. You can do a monthly payment or you can do a one-time payment. If you want to do a monthly payment, it's over 6 months. It's $800 a month. And then there's which equals, and this is all Canadian funds. So you get 30% off because you're going from American to Canadian. So this works in your favor.
Okay.
Um, yeah, so 4,800 is the whole price, and then there's a one-time commitment deposit of $300, which is not included in the registration fee. That's for people who want to do the monthly payment. Or if you want to just do a single pay, it's 4,600. There's no commitment deposit and there's no monthly payments. But I do have an early bird rate
I
on
saw
at the
that
moment.
10% off. 10% off?
Actually, it's a lot better than that.
Oh, good.
Because it starts in September. So you're like
September?
it starts in September on the 14th of September. So right now, this is limited, but you get $1,000 off on your registration fee. So then your monthly payments would be $633, or you could do a single pay of $3,600, and then applicable taxes, of course.
That's more like me. That sounds more like me. The second one, September
In terms of
14th.
the in
Yeah,
terms
in
of the
terms of
price,
the, yeah, in
you mean?
terms of how I can deal. The second one, the September 14th, you said $1,000 off, and then 633 a month or $3,600. Did
Yeah,
I get that right?
yeah, yeah,
Okay.
yeah. 633 a month, and the month it still has the monthly payments has the commitment deposit because that just shows you're gonna
The $300. Yeah.
continue through. Yeah, you're gonna
Yeah.
continue through. Otherwise, um, otherwise, if you want to just do the single pay, then it's just done. So let me just call up a currency conversion and see what that works out to for you. So, do you have a sense of single pay versus monthly pay? What you would prefer?
It's a whole summer away.
Mm-hmm.
You know, right now I'm having a hard time. Our work got hacked. Our hotels got hacked or something. Something terrible has happened in our hotels. Omni hotels. They're repairing us one at a time. It's been since Thursday, and we still can't see our books. We can't see anything. We are a convention hotel. So I'm really hoping to, just make enough money during the summer to just pay this off in full.
Yeah, yeah, for
But
sure. I hear you. And it's easier, it's often
I'm
easier just
starting.
doing one payment. So just letting you know with this early bird rate, 3,600 Canadian equals 2660 US.
What?
Yeah.
Wow. That should be easy to make by
Yeah.
September. If
Well,
I'm,
this price won't be here in September. This price is only here right now. In September, it'll be either 4,600 if you want to do a one-off. Let me just look what 4,600 is. 4,600 is 3,400 US. 4,600 Canadian, 3,400 US. Yeah.
by when
So
would that need to, by when would you need that?
the let me just look at my calendar here. Yeah, so that would be July 31st would be your last day for the early bird rate. But this super early bird rate is, yeah, it's here until until May, and then May and June are the early bird rate, which is $500 off, and then July and August is the regular rate.
Okay. I will
Yeah,
probably I don't know. I'm going to think about it. But I'll probably be on the July 31st list and
yeah,
paying the whole thing, just because I have to make time. And I'm going to make time for this. I just changed my schedule so that I can have more evening time at home, to do the travel advising that I'm doing, which is one of the most satisfying jobs I do, is helping people find their perfect vacations.
yeah.
Um, and then I only have to grind at work 5 hours a day, 25
Mm,
hours a week. So I'm looking forward to just reducing my hours to 25
yeah,
weekly.
I hear you. Yeah, for sure. So just to be clear, like June 30th is when
The $1,000 off goes
the
away.
um the $1,000 off, yeah, the $1,000 off goes away June 30th.
Okay.
Yeah.
I'll do my best.
Yeah. Now
I'll
there's
work
always the
hard. I will work
comprehensive.
hard.
Yeah.
Comprehensive?
There's always the comprehensive option if you feel like you just want the technical training, you don't want the support, you don't want the business side, you don't want to do the practice video review, you just want the information. The comprehensive training is 2,300 Canadian. Let me just put that into my converter here. So that's 1,700 US.
I think I would really like to get with the mentorship, that's 200 hours,
200
right?
hours. It's robust.
And
Yeah.
that goes toward my national certification board. Is it the same one?
Yeah. So the comprehensive training, um, the comprehensive training actually is what we are getting the certification, not the certification, the credits for.
Mm-hmm.
But actually, I can look into the whole mentorship academy getting done too. Why not? I was really just thinking of the technical training, but like, yeah, that's, I'm gonna look into that.
I haven't seen anything that's over 5,000. Is that right?
Nothing over 5,000.
Nothing over 5,000. Great.
Well, actually, if you did
Oh,
the monthly payment on the regular rate, which includes the commitment deposit, that equals 5,100 Canadian, but that's not what you would pay Americans. Let me just choose 5,100. Yes, 3,700 basically,
yeah.
3,770.
All
Yeah.
doable. All doable.
Okay. All right.
I have a little nest egg. I might be able to do the June 30th, but I always like to keep my nest egg safe, from my house falling apart. But
Yeah.
I could
Yeah. I
probably
mean,
the June
yeah, I
30th to
understand
save
that.
more.
Yeah, I
saving
do.
more.
I really understand that. And as a, as a person responsible for my own financial well-being, I like having a bit of a buffer around me. I don't like it when
Hmm.
I'm too close to the bone. It's very uncomfortable.
Me too.
But investing in training like this, it does increase your capacity to earn, and it gives you something really recognizable in the world where you're like, I've got a business, I'm serving these people, I can charge a really good rate, and people recognize me for what I'm doing. And because you're first in the area to be doing this work, then
True.
you're the one that people are going to build the association with, like, this is the person to go to for this type of work. So it actually does build in some financial security into your future. Yeah.
What is your rate per hour or whatever your sessions are?
I charge
Your own personal
140 an
ones?
hour.
140. And
Yeah.
what is that US? Can you tell me what that is?
Yeah. I'm just going to look it up here. 140 is 103. What's standard in your area?
Basically, if it's an hour, it's 150.
Yeah. So, well, there's a difference between spa massage in Canada anyway. There's a difference between spa
Oh,
massage and like massage therapy. So if I went to a spa and had a massage, I could pay up to 250 an hour for a massage to the spa, but that doesn't mean I'm getting 250. It means the
hmm.
spa is getting 250. And my payout as a massage therapist might be like $80 or $70 or something like that. If I'm going to a massage therapist in my area, massage therapists are typically anywhere from 110 to 120. So I've sort of positioned myself, $20 to $30 above what my typical massage therapy person charges. So whatever your typical massage rate is, if it's 150, then you could charge, 170, 180 in your
Hmm.
area because you're above what the typical RMT training is, or LMT, I
Hmm.
guess, in your area, right? You're in LMT.
Hmm.
Yeah.
Right.
So whatever, you just translate it to your area and then add on, another 20 to $30 because you've got this advanced training.
Okay.
Yeah. Yeah.
I'm not
Like I wouldn't
proud that
expect
we
it.
are up to 150. I'm not proud that we're up to 150. I hate that. 150 an hour is a lot, but this is what they pay for, and my the work where I work, they charge for the basic 50-minute massage is 185.
Right.
And then they have to include the tip. So it's usually like 222, something like that for an 50-minute service.
Yeah. Yeah. And it's always a little bit different. I never totally understand why spas, except for their exceptional atmosphere, can charge so much because often the treatments are a lot more basic than what you would get if you were in a
Yeah.
clinical setting. But that's just kind of how the world has set itself up. So you like the basic premise is you figure out what your local rate is for an LMT treatment, and then you position yourself 20 to $30, or maybe in your area, the equivalent would be like $50 above what the typical LMT rate is. Yeah.
Okay.
I mean, if you want to, you don't have to, but the option is
Hey, it's
there
great
because you have.
ideas.
Yeah.
I'll
Yeah.
suck all your ideas in, bring them to me. It's like
Oh, that's
lift it
funny.
and push it in, push it in, push it in.
I love it. That's so good.
Okay, well, I'm sorry I've taken so much of your time. I appreciate everything. I'm excited. Very excited. I love that you're doing this and that
Thank
I
you.
saw it on the day that I needed to see it.
Oh,
I saw it when I needed it. And that part is special to me. I'm searching, and then there you are.
oh,
And I was like,
amazing.
what is this? And you know, on my LinkedIn, I was read through it. I'm like, I have to put this on for something for me to read when I get home. And when I was reading it at home, it was like, oh my God, just reading. It's like, this is what I want to do. I don't want to do, I still love to touch people. It's my thing. I love, it's my love language because I love it to touch people. But I will say, I feel lonely, and depressed sometimes because I do it, but I don't receive it. I'm like, I'm giving you all of the love. I'm just throwing it all out there, and I come up empty on my side. And I don't want to. I don't know if that sounds. I don't know. Like I have to have something from this massage. That's not it because I give all day long. I give and give and give. I just want to relax and not worry if I don't receive. I'm
Yeah.
okay.
Yeah. Yeah. Different roles. One is the giver, one is the receiver. And yeah, there's different ways that we interact with care. Sometimes it's personal, sometimes it's professional. But I will say, working with this population is the most gratifying work I've ever done. People are so grateful, like way above and beyond what the general populace gives you in return. It's not the same at
Mhm.
all. And that's one of the reasons that for me, it makes it really sustainable because when I was just a generalist, people would come in and I would give my all because that's how I operate. And then they'd be like, okay, thanks. And they'd leave. And sometimes they'd be really grateful. Other times they'd be very kind of matter of fact. And
Mhm.
sometimes they were just being lazy. They could have done what they wanted to do, but they're like, well, I don't feel like it. You do it for me. And I felt like I was pouring myself out and really getting not that much in return.
Mhm.
But when I started working with this population, they were like, thank you so much for seeing me, for
Mhm.
being here with me, for being a part of this journey. And it means so much to me. And like, I got so much more in return. And I think that's important because we're a part of the equation. Like, we're not
Mhm.
exempt from the whole healing experience. We're helping to facilitate it. What we bring to the table matters. And if we're working with a population that really appreciates what we're bringing to the table, then we're getting that personal and professional satisfaction of like, oh, these people are moved by what I've offered.
Mhm.
They're like, they're soaking it up, and then in return they're giving me something back. And it's a lot. That's one of the reasons why I think it's so sustainable, because it's not so much of a one-way street. Like, you're not just giving out and not receiving in return. You are receiving back. Yeah.
Well, is in does it work the same way in Canada? We we see massage therapy as a healing art. Do you see that way? Is it kind of the same way? It's a healing art. Uh,
I really believe in the art of massage. The typical culture of massage therapy is that this is a medical profession and it's a science. But I really believe in blending the art and the science so that both sides are coming together. Because, and I talk about this all the time in my courses, when you're bringing the art and the science together, that's when you have the major transformation, because you're bringing all the loveliness that massage is and the soft skills of your presence and your intention, your mindfulness, and your human centric care, and you're combining that with the
mhm.
science so that you're evidence informed. You understand about the stages of healing, you understand about scar tissue, about the surgeries, the blood vessels, the nerves, like all the things. And then you're bringing that together and creating truly extraordinary experiences for people and for yourself. They're effective
Mhm.
and they mean something, and they're beautiful to both give and receive. So I think that's the strongest position to be in.
I
Mm-hmm.
do too.
Yeah.
I'm always irritated that if someone complains about massage. It's really hard to have a bad massage. I mean, it's really hard, I think. I mean, it's not very common where I work or to have a bad one. It's when the complaints happen, we're all like, "What?" Somebody's complaining about my work. Nobody's ever complained about my work when I did other things, so why are they complaining? And I started thinking, but this is a healing art. We're in we're giving art. This is my art. This is how I'm going to heal you. This is what I'm putting out in my heart and soul to help you, and if you complain about the art, who complains about art? You like it, you don't like it, it's, you don't like it, get rid of it, have your, whatever kind of art that you like. But this is different. This is coming from my soul, in my heart and soul, and I don't like it. I want my money back. It's like, here, take it. Here's your money back.
Yeah.
I don't
Yeah.
want your money. This is,
Yeah.
I paid attention to you. I was here for you for 1 hour. I listened. I touched you. I felt you. I validated you. I made you feel better. And just because I did something that you didn't like doesn't invalidate the rest of it, that
Yeah.
I did this for you. And you're like, that wasn't so good. I hate that. But I'm in an
Mm.
environment where, if you don't like it, you don't have to pay for it. Oh, we'll just take
Mm.
it off. Oh, we'll just give this to you for free. I'm like, I worked, you know,
Yeah.
I did something to them. I put my mind and thoughts, and my hands that know. I put all of this together and for this one person. I can't help what was going on in her mind, at
Yeah.
the time, but I
Yeah.
know in my mind I was centered and ready to help.
Yeah.
And it's really hard to receive complaint
Yeah.
about your art. I mean, like, would you
Yeah.
complain about art on the walls? Like, oh, that's gross. Take that down. Like, no, somebody else may like this.
Yeah.
Somebody else who's like, woo, someone else can come back in and say, this is incredible. I want to put this over my bed.
Yeah. 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 And you probably won't run across those reactions with this population because they don't approach it in the same way. It's like I've never had, in all the years of working with this population, I've never had one person who said, I didn't like your treatment and I want my money back. Like, not even once. So, they're coming to the treatment with a very different intention, and they're seeking healing. Honestly, they're so glad there's just someone who can touch them in that area. Most people are freaked out and they're like, I don't want to. And, through these courses, we learn to normalize the care. It's one of the very primary things that we're doing at the Mastectomy Guide is to normalize this care so that people feel comfortable giving it, they feel comfortable receiving it, they feel comfortable talking about it. And eventually, my goal is that we just change the culture of breast and chest care across North America so it becomes as normal as going to get your hair done or going to get your nails done or other, self-care activities. You can get your breasts and your chest worked on too. It's fine. So it's my big ultimate goal.
I had a question now. I was looking through what was it? What was it? So the mentorship is separate from the scar science of
Oh yeah, you
scars.
wanted to talk about the scar science. Yeah. So
Yeah,
a
that's a
lot of the
class I'm interested
information,
in.
yeah, a lot of the information you do get in the Mentorship Academy, but not all of it.
Okay.
So
Okay.
this course in October in Victoria, it's definitely very scientifically oriented, but I never divorce myself from blending the art and the science, so that's embedded in everything that I do. But we do deep dives into the nature of collagen, of connective tissue, of wound healing and scar formation, so that you're getting a good understanding of working with scars through the different stages of healing. So
Did
like
you say collagen? The first word you said was that collagen?
collagen. Yeah,
Okay.
yeah, yeah. So you learn how to work with immature scars versus mature scars. You learn about keloid scars and hypertrophics and what is going into those. You learn about the primary body systems that influence scar tissue healing and how we can work with those body systems so that we can influence how scar tissue develops. And all the techniques are very light touch. They're very minimalist, but they're very effective. Yeah.
Okay. Sounds good.
Yeah. Yeah, it's really worthwhile. And Kathy and I have different teaching styles, but we're very compatible, and it creates a really good environment in there because we just kind of play off each other, and yeah, it's fun. It's a good course.
Okay.
Yeah. Yeah. And that one
Uh,
is 568,
oh,
598,
560,
sorry,
like 600
598.
bucks
Yeah, like 600
for,
Canadian.
so if I got a couple friends to go with me to Victoria, BC, that would be fun. I want to
Yes.
see a whale. I want to see a
Yes.
whale.
Yes. It's
That sounds
entirely possible that you could see it up there. So
okay.
598, which is before tax, equals 442 at the moment for you in US dollars. And there's always a
Okay.
little bit of fluctuation, in the
And it's only
exchange
one
rate, but
day. And how many?
it's
It's one
2
day and
days.
how many hours? Oh, 2 days. How many hours?
2 days, 8 hours a day, so 16 hours altogether.
Ooh, 16 hours.
Yeah. And you get hands-on practice time with the other participants in there. Yeah. And live demonstrations. Yeah.
I like it.
Yeah. It's really worthwhile.
Yeah, I think the mentorship 200 hours is probably for me. I think it is. I'm sure it is. What I'm reading, then I may just take an extra course like that. I don't know. If I get all the information, if I can get some other people interested in only this part, because that's what most of the ladies I'm working with who have had their surgeries, they really want to know just this part of how to heal themselves
Yeah.
because
The scars.
the scars,
Yeah.
yeah.
Yeah. Yeah. Yeah. Okay. Well, this is so wonderful
Okay,
talking to you.
thank you. It was wonderful talking
Yeah.
to you. Thank you. I didn't mean to keep you on more than 30 minutes, but I'm so glad I've got pages of things to read and think about.
Yeah. Yeah. Absolutely. And I'll send you a follow-up email so that you've got this information in your
Okay.
inbox of the things that we talked about today. And then you just let me know when you're ready. If you decide this is what I want to do, then I will be there to help you get in. Probably by June 30th, there'll still be space left, so I wouldn't be too
That's the
worried about
day.
that. 'Cause it
Okay,
starts in September.
I'm gonna underline, scratch, star it.
Yeah. Yeah.
I got it. I got it.
Okay. Amazing. Well, thank you for your time, and I will
Thank you.
chat with you again soon.
Okay, thank you. Good night.
Good night. Bye.